Hello. So we will discuss the matter is the scientific methodology and nursing methodology. So the first time I will introduce myself, and my name is Muhammad Rizki, and my student number is PO 712012200016. Okay, let's check the presentation. Okay, next. So the first one we discuss is nursing process. So what is the nursing process? I think the nursing process functions as a systematic way to client-centered care with five sequential steps. These are assessment, diagnosis, planning, implementation, and evaluation. So I will discuss this five sequential steps for the next presentation. Okay, let's see. Okay, this one assessment. Assessment we assessment have three steps. For the first one is collect data patient with organized data patient and validate data patient. And for the next step is diagnosis. Analyze data, identify health problems, risks, and strange, formulate diagnosis statement. For the next step, we have planning. Uh, Planning with prioritize problems and diagnose patient with formulate goals and desired outcome. So select nursing intervention and write nursing intervention. For the next step is implementation. The raises the patient determine the nurse need for assistant, assistance, and implement the nursing intervention. And the next step is supervise delegate care and document nursing activity. And the last one is evaluation. It's very important, The nursing process don't have evaluation is nothing. And for the evaluation, we have where we must collect data related to outcome. If we not relate with patient, it can be so dangerous or will be the we got a wrong patient. So we have to compare data with outcome, relate nursing action to patient goals and outcome, draft conclusion about problem status, continue, modify or terminate the patient care plan. That's all the way you can do for your patient health care. Okay, the next one is scientific methodology. By the way, for scientific methodology, what is scientific methodology? The scientific methodology is the process of objectively establishing facts through testing and experimentation. The basic process involves. The first one is making an observation, forming a hypothesis, making a prediction, and conducting an experiment, and finally analyzing the results. So let's check what the step is scientific methodology. Let's see the picture is for the first one is we have uh to being observe the patient and the second one is we have to give patient with question something like are you feel bad are you feel all right are you feel good today. And the next step is hypothesize. Hypothesize is something like you write on the You write in the patient, uh, identify patient health, and after that we test the what being patient seeks and conclude. We share about what's the patient's what the patient have to do being fixed, and we riddle or we repeat again the patient we repeat again the patient 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 something like that. Okay, the next one. Okay, this one. Let's see the picture. For the next, the first step is assessment of relevant existing knowledge about a problem or opportunity, or we can see the first one is exploratory research. So we have to know about the patient, about the the conclusion, or something like what happened with the patient, something like that, I think. And number two, the second step is formulation of concept and proposition. So uh, before you before you before you meet your patient, you must get some formula. Write your formula with the concept of proposition. The the, s- the next step is statement of hypothesis. Yeah, something like you write on the the patient's sickness, I think, but I don't know. And the second, the next step is design of result to test the hypothesis. Oh, sorry. Formulas of concept and proposition and statement of hypothesis is descriptive research. So we have after we explore the research, we know about the patient. Describe we describe the patient. How about the patient being sick, so something like that. And on the next step is acquisition of meaningful empirical data, and the next step is analysis and evaluation of data and design of result of to test the hypothesis, acquisition of meaningful empirical data, analysis and evaluating of data is casual research. So it's just a casual research. Something like, yes, the patient is being sick, some like that. The patient must be being sick because the patient got the patient get hypertension or hypothermia, something like that. Purpose, the last one is proposal of a solution for the problem or how to explore the opportunity and statement of new problems or opportunities raised by the research. So after you meet your patient, you make some proposal to be a solution for the patient problems, and you get the statement, and you can get something a new problem, I think, and you get arised by the result, and you can know about the patient that before you get a new problems for the patient. Okay, next. we must have what's a difference about nursing process and scientific methodology. I think is yeah, nursing process is a method that is used to systematically identify the client's status of health. This process is helpful for nurse to provide a better health facility to the client. It is a five-step process which begins with by first collecting the data of health healthcare status of the client, then the diagnosis the problems. And we know the scientific methodology, on the other hand, is a methodology used for the observation and experimenting. It's a problem-solving approach which follows 6 steps for experimenting. The step begins with making an observation or identifying the problems, and then data collecting procedure is followed. Thus, the major difference between the two methods is nursing process first collects the data, then make an observation, while scientific methodology first makes an observation, then collects the data. Okay, guys, that's it. I think so. Thank you for the attention. See you for the next presentation. Bye.